Hello, everyone. I'm Devin Thorpe, your host for the Or in the World show, and we're producing this episode for Forbes.com, where I am a contributor covering social entrepreneurship and impact investing. We are thrilled today to have a couple of extraordinary guests. We've got Dan Buettner, the best-selling author of Blue Zones, along with Executive Vice President Laura Jackson from Wellmark Blue Cross Blue Shield, that is implementing some of the principles from Blue Zones. Laura and Dan, welcome to the show.
Nice to see you, Devin.
Well,
thanks, Devin.
We're so glad to have you both here. Dan, why don't we start with you, because really the story starts with you. Tell us quickly about what the Blue Zones story is. Give us just a 2-minute overview of what it is.
It began with a National Geographic project that sought to, in a sense, reverse engineer longevity. So instead of relying on academic studies and so forth, we worked with a team of demographers. We found 5 geographically defined and demographically confirmed areas where people have the highest life expectancy and also rates of chronic disease, heart disease, cancer, diabetes, etc. And they're reaching age 100 sometimes at 10 times the normal rate. And then we brought another team there to distill down what exactly are they doing and what are the common denominators we see no matter where we go, whether it's Okinawa, Japan, Sardinia, Italy, the island of Icaria in Greece, Costa Rica, or among the Adventists here right in the United States. And remarkably, we found that no matter where we were and over again, and in a cover story for National Geographic, another story from the New York Times Magazine, and a book called The Blue Zones, we detail our findings and suggest that these populations might offer some pretty good lessons for Americans who are struggling with a lot of these diseases now.
Well, because Americans don't have the greatest longevity in the world. We don't have the best infant mortality. We're not the most healthy population on the planet, certainly.
We're sort of the middle of the pack when it comes to longevity, yet we spend more money per capita than any place else in the world. So there's an incongruence there.
Well, Dan, can you walk us quickly through those 9 principles? Because these are so important. I hate to have you on the show and not get that insight for our audience.
Yeah, so number 1, by and large, these long-lived people aren't exercising, but they live in communities where every trip occasions a walk. They move naturally, as opposed to their daily life is punctuated with little bursts of movement every 20 minutes. They suffer the same stress as we do, but they have sacred daily rituals to reverse the inflammation that comes with stress, either through prayer or napping or meditation. This is really important. They can articulate their sense of purpose, which is associated with actually lower rates of dementia, and some studies have found it adds an extra 7 or 8 years of life expectancy as opposed to being rudderless. When it comes to diet, they eat mostly a plant-based diet. They do drink a couple glasses a day of wine, but rather than focusing on what nutrients to bring into their diet, their little strategies involve pushing calories out of their diet, either through the way they set up their kitchens or what they say before meals. And then really the foundation of these 9 principles, these Power 9 as we call them, is investing in family, keeping aging parents nearby, investing in your spouse, which is worth about an extra half a year of life expectancy, belonging to a faith-based community. Doesn't matter if you're Muslim, Jewish, Christian, but that can add up to 14 years of life expectancy. And the big point is knowing who your friends are. We know if your 3 best friends are obese, there's about 150% better chance you'll be overweight. So carefully curating that group of 4 or 5 people who you're spending your time with has enormous impacts on how healthy you're going to be over the years and decades to come.
That is so fascinating. Dan, thank you very much for sharing that. Of course, these principles are outlined in your book, The Blue Zones, and in the sequel, what was that one called?
The forthcoming book will be The Blue Zone Solution, Eating and Living Like the World's Healthiest People. It's more of a prescriptive for individuals.
Fantastic. Look forward to that. Now, Laura, you've been taking Dan's concepts and applying them in the field, actually getting people to start living more of these 9 key principles. Tell us a little bit about your program and how it's working.
Well, I would say, first of all, Devin, it's really our program. We work very closely with Dan and with Healthways, one of his key partners that really brought all of us together. And we challenged the state of Iowa to see if they were interested in creating healthier communities and put out a call for anybody who was interested to apply, and had over 83 communities demonstrate their interest, apply for this opportunity. And then Dan and his team and folks from our team, we actually did site visits to pick the communities that were most ready to be what we call demonstration sites. So we have over 15 communities today working to implement these Power 9 principles so that they can have healthier environments that nudge all of their citizens into healthier behaviors. And it's been absolutely fascinating to watch the transformation happen.
Give us some examples of communities or individuals that are adopting and what they're seeing in terms of changes.
Yeah, some of the stories that we hear are just, they make you come back to work every day. So examples that you would see, Spencer is a great example, small community up in northern Iowa. They have a city manager that was and he tells this very openly, so I'm not disclosing anything inappropriate, but he's very open about the fact he was taking several medications. He had gone to his physician. He had seen his father pass away from similar chronic diseases. And he said, I can't do this anymore. At the same time, the blue zones come into his community. He's very entranced with the whole concept and starts to live the blue zones way. And before you know it, he is no longer taking any medications. In fact, he has all of his numbers in check. And what he will simply tell you is he embraced all of these principles, and as the city manager started walking his community, realizing how hard it is for him to walk, and let alone his citizens. So not only did he change his own health behaviors, and he's now pleased to say he's going to be here to watch his grandkids grow up, but he's also been just a passionate zealot about changing the infrastructure in Spencer, connecting sidewalks so it's safe for kids to walk to school, creating walking school buses, making sure that engineered activity is very easy for citizens to get just because it's there. Yeah. So that's an example.
Now, Dan, you had done a pilot program with Albert Lea, right? Can you give us a quick summary of the results of the pilot program in Albert Lea in terms of some of those measurable outcomes?
Yeah, so the key tenet to all of this work, if you look at cultures of longevity around the world, these centenarians weren't trying to live to 100. Health wasn't something they pursued, it's something they ensued. So in 2009, we came to Albert Lea with the idea of, why don't we see if we can help create a culture here, help create an environment that makes the right decisions for people, or makes the right healthy decisions easier. And over the course of about a year and a half, we saw the average weight of the participants drop by about 3 pounds, which is significant over a population. We saw their life expectancy go up by over 3 pounds. But most significantly, we saw healthcare costs amongst city workers, claims costs, drop by about 40%. And at a time when we're spending $2.1 trillion on healthcare costs and the related costs from sickness, it demonstrated that thinking differently about health can really work at the population level.
Now, Laura, are you seeing some of those same cost savings resulting in your early days here in your efforts with the Blue Zones project?
We are seeing some early indications in certain communities and in certain populations. I would say it's probably a little bit early to tell from a true claims experience from a health insurance perspective. But the pieces that we are following very closely in the communities that started first, because we've actually staged the starts, they are demonstrating a good trajectory, which we're very pleased to see. That's one of the biggest reasons we did this.
Now, you've got some, not just Iowa communities, but also California communities on the program now, right?
And that's really Dan's work, so I will kind of pass that back to him.
So Dan, who's your partner in California?
It's called the Beach City Health District. It's a foundation committed to getting the community healthier. And to work up to working with Wellmark and working with the whole state, we went from Albert Lea and then to a city of about 150,000 people. It's actually a confederation of cities. And in the 2 years working there, again, the operating system here is, it's not a program. We change the environment so it nudges people into eating less, eating better, moving more, socializing more, and volunteering or executing on their purpose. After 2 years, with Gallup measurements, we saw an obesity rate drop by about 14%, a smoking rate drop by 30%, and healthy habits went up by about 10%. And Gallup's economists projected about $11 million healthcare savings over time because of those short-term improvements.
Yeah, huge, huge. Laura, one of the curiosities I have, and you're there as a business executive making this happen and trying to drive change, but one of the biggest drivers of longevity was faith and belonging to a faith-based community and socializing with people. We're not socialized in the United States to think of those things as being the purview of our doctor or the healthcare system, or certainly, or much less an executive at the healthcare insurer. So tell us a little bit about how you're going about fostering some of these social aspects that are so important to health.
I think that Dan sets it up very nicely when he talks about what he found in the blue zones, and he will talk specifically about, it's not a specific fit that's important, it's actually the feeling of belonging and having some level of spirituality. And that being a basic tenet of all these principles, when we went to these communities who said, pick me, I would like to demonstrate that we can make these changes in our environment, the faith-based movement or any of the challenges becomes their job, not our job. So it's really quite easy to talk about these principles, helping them live longer, healthier lives and nudging them into healthy choices. And as faith being a pillar of that, the community gets to choose how they implement it. So fortunately or unfortunately, I don't have to, preach anything to them. They actually decide how they want to engage their community members, and they've done so very effectively.
What are some examples of things that communities are doing on these social aspects to foster more friendships, more socializing, more church going, or whatever?
Yeah, I think Cedar Rapids is a great example. They experienced a tremendous flood not so many years ago and have really worked hard to bring their community back. One of the things they did in applying for the Blue Zones demonstration site, they saw this as a revitalization movement for them as well. And they recreated in their Bohemian district and just a very impressive market, and they have made sure that people can walk and bike to it. And it's really become a gathering place. It's almost like a modern day community center, if you will. But it's healthy in terms of the food it's served. It's become a social outlet for many people to come and meet. They host a lot of community meetings there as well. But we also have benefited tremendously from Dan inspiring people to start what he calls walking wise. So these are groups of people that may not have known each other before, but they actually decide that they're going to kind of take care of each other, nudge each other into walking together. They end up meeting new people and talking about things and really keeping each other on track to get active. The Walking Wise have been wildly successful. And I think from the social aspect, the volunteering in these communities has been really immeasurable. You can count the number of volunteers, but every community has said that this project has brought them together in ways that they could not have imagined. They've met people in their community they never met before. And so they have a new bond. They have a new spirit and passion in their actual community, which is so nice to see.
It is interesting, of course, when you think about this coming from the standpoint of how do we create health, that if this improved socialization is required for health and we accomplish that, there are a whole host of other benefits that communities get when that happens. Dan, I wonder if you would take just a minute and talk about where we go from here for expanding the Blue Zones project. You're going to need more partners. There are, I think, 300,000 people in your program now. We only have about 314 million to go to get the people in the United States. How are we going to scale this up?
Well, we're really focused on being successful in places like Iowa. I want to take a moment to salute Wellmark because, we in this country we spend about 80% of our budget, our healthcare budget, on getting sick people less sick. And Wellmark has said, well, wait a minute, let's try to get people healthy in the first place. And it is an absolutely revolutionary idea, and I think it shows commitment. We know that unless we can demonstrate it very well in places like Iowa, it's not going to scale, because you can talk theoretically all day long. We put in place 150 small nudges. The communities we work with decide what nudges work the most best for them, and then we measure it. And we're really focused on hitting the ball out of the park right now with Iowa. We started for 5 years. There's another 5-year plan on the boards, and it takes a long time. But if you put in these long-term environmental changes, unlike diets and exercise programs, which are always short-term successes and long-term failures, the types of things we're putting in place yield long-term impacts in better health, higher levels of well-being, lower healthcare costs. And right now, we're working in 20 cities. Fort Worth is another one, HMSA in Hawaii. But we're really focused on making sure it works there first. And we don't have to go out and promote it then. People come to us. And that's what we found.
Now, there will be people who are listening today that are eager to get involved with the program, to learn more about it. Laura and Dana, maybe in turn you could both just talk a little bit about how people can engage with you, how you'd like people to engage with you, who you'd like to have engage with you so that you can move your objectives forward. Laura first.
Yeah, I would say, one of the things that Healthways and Dan and the Blue Zones were willing to do with us to really support Iowans, even if people don't live in a demonstration city, they actually can go on to the Blue Zones website, and there's a specific Iowa website where all the tools are available. So if people want to learn more, if they live in a community where they just want to take one thing that they'd like to implement in their life instead of the 150 opportunities that Dan and his team have really engineered through science, they can do so. And so we really aren't looking for people that want to sell something. We're looking for people who want to be part of something and really make changes in their own daily life.
Fantastic. Dan?
Part of the secret sauce here is we've only worked in cities where leadership works really well together. There's a readiness. Certain people are tired of seeing 60% of their population or 70% obese or overweight and are really ready to innovate. And those are the cities that we end up working with. If they go to bluezones.com, we have a contact us area there, and they can send us a note. If they think their city is ready and they really want to make the commitment, we can contact them. But just the Blue Zones Iowa site, I think, will give any city a pretty good idea of how to do it themselves if they want to, or they need our help. We're happy to help.
Fantastic. Well, I thank you both for taking the time to be with us today. It's been a real delight to learn more about the program and to see the potential for really changing the health of Americans and ultimately people around the world. So again, thank you both for taking the time to be with me today.
Thanks, Devin.
Thanks, Kevin. It was fun.
All righty. Let's do some good.